Okay. Yes, thank you, Agnieszka, for introducing me. I am Sibilla Neimane. I represent National Center of Mental Health in Latvia. I am head of scientific project units here in the Scientific Institute of Mental Health, but today I am here to represent also as a coordinator of the project Mental Health Together, or as we call it, Mentor. Here is a very traditional slide of our joint action projects, the map with all of participants that we have in our project. And I have to say we have quite a wide scope of countries, so 43 partners from 10 to 20 countries across the Europe. And we are now in our first year of the project. We are very actively working on all of our deliverables. We have 31 of those in total, so a lot of work we try to do in the area of mental health. So let's dive in a bit more. The project aims and goals. So our main goals are really to promote mental health from a wide spectrum, from political initiatives to clinical professional practices, and really cover a lot of the ground for all of the fields, let's say, and we really try to not just only do some methodologies or guidelines for the policy recommendations, but also some initiatives and activities and programs that can be used for practitioners in their everyday life. And we also, of course, try to do all of them in a sustainable way so that the programs and initiatives do not end just when the project ends. And we have in total 3 years. This is the first one of those. And we really hope that a lot of what we have planned will live longer than the mentor official period. Here is also a very traditional slide for joint actions. We have divided all of our work into 6 work packages. We could have more, but we decided to stick with 2 quite big sections. So work package 5 is more related to the policy. Policy content, and work package 6 goes more into digital tools in the area of mental health. And so what we try to do in work package 5, we are working currently very rapidly on the methods to evaluate and implement mental health in our policies approach. This is quite important topic, not only for our project, but also for many countries in Europe. We also are working to develop different policy recommendations and intervention tools for young people and vulnerable groups. So we have divided them, all these recommendations and best practice approaches to each of the vulnerable groups representations. So we really try to, again, cover quite a large scope of people. And also, another very important aspect of the mentor project is to involve people with lived experiences and really use their recommendations and insights to better develop the healthcare services. And currently, we have some really promising activities going on. So I hope that in the next months and years, we will be able to show you more of the practical sides of all of that. And also, our colleagues from Italy are developing very interested person-centered care model with the financial model with the person being at the center of the services he's receiving and not just from the general service perspective, let's say. And so the outcomes within the work package 5 also are targeted to support policymakers, both at national and regional levels, to really take a look at mental health in our policies approach and try to use it within their services and policy, and really look at it from different perspectives, and also share a lot of the methods focusing on the vulnerable groups while also addressing stigma and discrimination. That is also another very important topic across Europe. And we really will try to provide stakeholders from different levels on how to better include people with lived experience in the policy making and also the healthcare services, as I mentioned before, because we really see that this is how we can reach different vulnerable groups as well, and really to hear them, what is important for them, because one thing is how we see problems for specific target groups, and another perspective is how they see what they need. And so we try and hope to give a really useful and practical recommendations to use not only for the participating countries within our project, but also for others. And I think this is one of the things where both projects can work on the synergies as well. Diving into work package 6 a little bit more, we are identifying and searching for promising good practices for promoting mental health and preventing some of the hardships that can be addressed for people with mental health issues. And we are really gathering a lot of information, and we will get we will develop this tool, or like a guide where you can take a look and use what is already out there, and not to invent something from the ground. And also, we have selected some of those tools to adapt and pilot within our project participating countries to see how we can scale up something that works good in one country and how it can be then transferred to other countries and services. And what else we are taking a look at within our project is really to develop and pilot online self-report tools. And we see that it is important to not only promote, but always assess and evaluate the mental health outcomes at the same time. So we really try to work on it. And the outcomes that we hope we will be able to share across your projects participants as well will be this online repository for promotion and assessment tools. Also, guidelines for adverse childhood experiences, because we see that even though there's a lot of digital information and how to use it and for promotion, etc., but it's also important to see and recommend actions against early problematic digital technology use to prevent kids from using too much digital technology. And of course, these pilot studies with evaluating both youth mental health and displaced persons from Ukraine, so migrants, that is another vulnerable group, very important for our project. We have also participants from Ukraine who are very motivated to try out this evaluating tool. And also, some of our participants want really to validate a digital self-administered version of the VHO tool, which is a composite international diagnostic interview for general population. And so with all of these tools, of course, we are in the first year of the project, so we are developing all of this, but we hope that we can share this with you as well. And when we took a look at the global health impact, your project, and we try to identify some of the synergies where we see that both the projects can benefit from each other. And we identified work package 5, 7, and 8 from your project. So let's see how we can do this in the most effective way. And since work package 5 is more into developing, let's say, policy recommendations and global health strategy, we see that this is something that could complement our mental health canal policies approach, and also for social inclusion and quality of life for people with mental health disorders. We see that this could be your approach could be very well transferred for mental health in our policy, and we could somehow let's say combine them or just build on the work you have done. So we will be very happy to receive your deliverables as well and see how we can incorporate the work that you have done into what we're doing. And I think this would be an amazing opportunity to sustain long-term effects from different projects, and for these activities to live longer and ensure sustainability aspects. And strengthening external communication contribution is another work package of yours. And I think we have this amazing opportunity to really share all the main information and targets and outcomes, deliverables with each other. We have Team Poland is leading work package 2 for both of our projects. So we have this very close connection here as well. And I think we should really use it to ensure that information is reaching a lot more than just the circle of each of the projects. So we will be very glad to receive more information from your side, and also for your suggestions forum. I see this is something that can be used for the sustainability matters for both of our projects to ensure that EU policy recommendations involve not just the one topic of what we have in mentors, mental health, but we can also incorporate other strategic approaches and topics that are out there. So yes, we see that our project can really gain a lot from yours as well, and we hope this can be vice versa. So we will be very happy to share our deliverables, our work done as well with you, and I hope that together we can reach even more stakeholders who think that mental health is important. Yes, so thank you very much.